encourage alloimmunization. Last sentence first, which of the following is correct regarding the potential condition her baby may develop? 26-year-old GP 10 women, okay, G1 P0 presents for first prenatal visit, O negative, father is A positive. Rogam, she is refusing. Okay. So what is the potential condition? Now, to talk about physiology here, the mother is O negative. The father is A positive. Now, what all blood groups can the baby have? The baby can have, so this is OO, and this is AO or AA. It can be any of those, right? We used to do this in our 12th grades, if you remember. Okay. Now this positive is dominant, this A is dominant, so the O negative, no match out of these, no cross matches will lead to an O blood group. There will always be at least one A. Okay, this can have one. Okay, if it is AO, it can have an OO. But if it is AA, no match can have O. So what I'm trying to say is that majority of the time, the dominant blood group will reflect in the baby, and there is a very high chance that the baby will be A positive rather than O negative or A negative. It is usually not A negative because it is on the same gene. And these are dominant. Positive ones are dominant. Now, if the baby has A positive, that means in his blood he'll be having uh, B antigens and no antigen for your rho. Whereas the mother will be having A and B antigens both. Okay, because the mother is O negative, she'll be having A and B antigens both. Now, when the blood of the mother, I'm teaching this for all those who are starting from basics, so those who already know, you'll have to bear with me. So what happens is when the baby is being born or when the baby is in the womb, there's chance of some blood of the baby leaking into the mother or some kind of blood getting mixed of the feto-maternal blood getting mixed with each other. So when this A positive will come in contact with the O negative, this A part will be hemolyzed because there are A antibodies already present in the O blood group. But these Rho positive cells will trigger an immune response and the mother's body will start producing anti-Rho, here anti-Rho or anti-D, whatever you want to call it, antibodies. Okay, now the baby is born, the mother has developed these okay, so the mother has developed these anti-D antibodies, the baby is born, nothing has gone wrong, nobody was affected. Okay, now the mother conceives again and the baby is again positive, right? Now this time when there is a mixture of blood, the anti-D antibodies in the mother will start destroying the raw positive cells of the baby, and the baby will undergo severe hemolysis and will develop what we call is your raw alloimmunization. So it will develop a severe jaundice, it will undergo hemolysis, and is usually not compatible with life. The baby might die in utero as well. It causes a condition called hydrops fetalis. So this happens during the second pregnancy. Okay. This is the basic physiology or the pathology. So now what we want to know is this. So what we do to prevent this is we offer the mother, whoever is negative Rho or B negative, we offer them an anti-immunoglobulin already. So this immunoglobulin makes sure that uh, now this immunoglobulin destroys the Rho positive cells entering and does not give a chance to the mother's blood to develop immunoglobulins because it already destroys it. Okay, so it is a preventative measure. So you give it at 28 weeks and again within 72 hours after birth of the baby. So you give this vaccine 2 times, this immunoglobulin 2 times. What you can do is in your wards, you can ask negative blood group women whether they were given a very costly injection or not. It is usually very costly, so they remember. Okay, So, because this mother has denied the preventative measure, there is a very likely chance that her second baby might be affected. The first one will be born as such, it will lead to the development of antibody. The second baby will be attacked by those antibodies. So, majority of the options are okay. So, the injection can be avoided. No, it cannot be avoided. The raw immunoglobulin protects the baby against other RH antigens. No, it is specific to RHD. She should receive immunoglobulin to prevent ABO. No, it is the anti-D or RH incompatibility. And the immunoglobulin is needed both before and immediately after delivery. True, but to protect the next baby, not this baby. Okay. So our answer here is that she should receive the immunoglobulin to prevent development of RH alloimmunization. Done.
Thanks for watching. Please give a thumbs up and subscribe for more.